As we grow older, our bodies begin to speak to us in quieter ways. Sometimes, what seems like a small skin irritation, a little redness here, a little itch there, might be more than just a passing annoyance. In today's video, we'll explore 5 common types of redness that can appear after the age of 60. And what your body may be trying to tell you. Some of these signs are harmless, others may be early warnings of something more serious. Let's begin. Type 1 Itchy redness, a gentle warning from the liver. Have you ever felt an ongoing itch on your skin, especially at night? And you just couldn't figure out why? No insect bites, no food allergies, no visible rash, and yet, the more you scratch, the more it spreads. You can't sleep well, you feel restless, and your body stays tired. Sounds familiar? Many people over the age of 60 experience this kind of persistent itching. But here's the problem, most people ignore it. They think it's the weather, or dry skin, so they apply some cream, scratch a little, and move on, but in some cases, that itch might not be coming from the skin at all. It might be coming from your liver. The liver is the body's main detox organ. Every day, it filters hundreds of liters of blood, processes medications, alcohol, food, and invisible chemicals we absorb from our environment. When the liver is healthy, we feel good, our skin glows, we eat well, and we sleep soundly. But after the age of 60, liver function naturally declines. Liver cells don't work as efficiently. And when that happens, toxins, especially bile salts, can build up in the bloodstream. Instead of being eliminated, these toxins sometimes look for a way out, through the skin. The result? Itchiness. Not on the surface, but deep under the skin. And it can be incredibly uncomfortable. Liver-related itching has a few typical signs. No visible rash or swelling, usually affects the back, sides, chest, arms, or thighs. Gets worse at night, causing trouble sleeping. Scratching doesn't bring relief, it may even make it worse. Most importantly, this type of itch has nothing to do with weather, detergents, or cosmetics. Whether it's hot or cold, inside or outside, the discomfort follows you like a quiet but stubborn companion. When itching becomes persistent with no clear cause, doctors often consider liver and bile issues such as fatty liver disease, chronic hepatitis B or C, early-stage cirrhosis, intrahepatic cholestasis, a condition where bile flow is blocked. And in rare cases, it could even be an early sign of liver cancer. Of course, not everyone who itches has liver disease. But if you're over 60 and you also notice dark-colored urine, long-lasting fatigue, bloating or discomfort after eating fatty foods, slight yellowing of the skin or eyes, a strange or metallic taste in the mouth, mild, unexplained fevers, then it's wise to have your liver checked. Because the liver doesn't usually cause pain, so when it speaks through your skin, it's already sending you an early warning. Why is this more common in older adults? Because with age comes chronic conditions, diabetes, high blood pressure, high cholesterol, joint problems. And many people take daily medications, sometimes 4 or 5 types. Every pill, even when necessary, adds pressure on the liver. If not monitored, liver function can quietly decline. Add to that poor circulation, weaker immunity, and a lack of vegetables in the diet, and the liver has a harder time doing its job. So what can you do if you suspect liver-related itching? First, avoid using topical creams long-term, especially steroid creams, which may actually harm the liver further. Instead, visit your doctor and ask for liver enzyme tests, AST, ALT, liver and bile duct ultrasound, bilirubin level testing, hepatitis B and C screening, if not done recently. And support your liver at home with simple daily habits. Drink enough water, 1.5 to 2 liters per day, eat more vegetables and fresh fruits, avoid fried foods and animal fats. limit alcohol and sugary drinks, get enough sleep, and sleep early, move your body daily, walking, stretching, tai chi. Anything gentle. After age 60, every little change on your skin, even a small itch, deserves your attention, because sometimes, it's not just the skin, it's your liver sending you a quiet call. A healthy liver is the foundation of a peaceful body, and a calm, itch-free skin is the first gift you receive when you truly begin to listen. Type 2, tiny red dots that don't disappear when pressed, a sign of bleeding under the skin. One day, you look down at your arms and notice a few tiny red spots. They're not itchy, not painful, and they don't feel raised. Just small, quiet red dots. Resting on your skin, you gently press on them with your finger, but they don't disappear, and you start to wonder, what are these? Should I be concerned? The answer is, possibly, yes, because these spots may be a sign of subcutaneous bleeding, also known as petechiae, a condition that's often overlooked, but may be your body's early way of saying, pay attention. Petechiae are very small red dots, commonly found on the lower arms, legs, backs of the hands, or even the abdomen. They don't itch, they don't swell, and most importantly, they don't fade when you press on them. Why? Because what you're seeing is tiny amounts of blood leaking from small capillaries just beneath the skin. Not enough to flow out, but enough to stain the skin from the inside. In people over 60, there are several common causes for this, such as low platelet count, making it harder for the blood to clot, vitamin C or B12 deficiency, which weakens blood vessels, side effects from medications like blood thinners or aspirin, chronic high blood pressure, damaging delicate capillaries, and in rare cases, it may be an early sign of serious blood disorders, like leukemia or clotting dysfunctions. So, when should you see a doctor? Please pay attention if these red dots are also accompanied by easy bruising, even from light bumps, nosebleeds or bleeding gums, unusual fatigue, shortness of breath, or unexpected weight loss, mild fevers that don't go away. If any of these apply to you, don't wait, go to your doctor and request blood tests, especially for platelet count, clotting function, and if necessary, deeper evaluations of the blood and bone marrow, beyond medical checks. There are also gentle ways to help prevent petechiae in daily life. Eat foods rich in vitamin C, like oranges, guava, and leafy greens. Get enough vitamin B12 from eggs, fish, or fortified grains. Stay well hydrated. Avoid long-term use of anti-inflammatory or blood-thinning drugs unless prescribed. Move your body gently every day to improve circulation. You see, sometimes, it's the smallest signs that hold the biggest messages. A few tiny red dots on your skin might seem like nothing, but in reality, they could be your body's first gentle reminder that something needs attention. So if you notice red marks that don't fade when pressed, don't ignore them, get them checked. Listen to your body while it's still whispering, because when it comes to health, timing is everything. Type 3, red, warm, swollen patches, a warning sign of skin infection. Have you ever noticed a red area on your skin, usually on your leg, that feels warm to the touch, a little swollen and tender? You might think it's just a mild allergy or a bump you didn't notice. So you decide to wait and see, but instead of getting better, the redness begins to spread. The swelling gets worse, the area becomes painful. And suddenly, you start feeling feverish, tired, maybe even lose sleep because of the discomfort. If this sounds familiar, then you may have experienced a condition known as cellulitis, a deep skin infection that should never be taken lightly, especially in older adults. Cellulitis is a bacterial infection, often caused by staph or strep bacteria, that enters the body through a small cut, a crack in dry skin, or even a bug bite you barely noticed. Once inside, the bacteria multiply and cause inflammation in the deeper layers of the skin. The result? Redness, swelling, warmth, and pain. In many cases, the skin becomes tight, shiny, and the redness can spread rapidly within just 1 or 2 days. How to recognize cellulitis? Common signs include a red, swollen, warm patch of skin, pain or tenderness in the affected area, skin that looks stretched or shiny. The area may develop small blisters or fluid-filled bumps, low-grade fever. Chills, or fatigue. It most often affects the lower legs, especially in people with poor circulation, varicose veins, or diabetes, but it can occur anywhere on the body, even on the face, arms, or abdomen. Why is cellulitis more common in older adults? After the age of 60, the skin becomes thinner, and its natural barrier weakens. The immune system also slows down, making it harder to fight off infections. Even a tiny scratch, a cracked heel, or an insect bite can become an open door for bacteria, and if you have diabetes, venous disease, or limited mobility, the risk becomes much higher. When should you seek medical care? If the red area keeps growing, becomes more painful, feels hot, or you start experiencing fever, fatigue, nausea, or chills. Don't wait, this is no longer a simple skin issue, if left untreated. Cellulitis can spread into deeper tissues and even the bloodstream, leading to sepsis, which can be life-threatening, especially for older adults. You'll need a doctor to assess the infection and prescribe the right antibiotics. Do not try to treat it at home with creams or herbal remedies. This can actually make the infection worse. How to prevent cellulitis? Simple steps can go a long way. Keep your skin clean and dry. Moisturize regularly to prevent cracks. Inspect your feet daily if you have diabetes. Avoid scratching, insect bites, or skin irritations. Wear protective shoes when outdoors. Closing thoughts. A red, warm, painful patch on the skin may seem like a small issue, but it could be the first warning sign of a dangerous infection. After age 60, learning to recognize the difference between mild irritation and serious infection is key, because one timely visit to the doctor for a skin infection can save you from a much more serious health crisis later on. Type 4, red, scaly patches, a sign of psoriasis. Have you ever noticed red areas on your skin, maybe on your elbows, knees, lower back, or scalp, where the skin becomes dry and starts to flake off like white powder? You scratch it, the flakes fall like dust, but the redness remains. The area feels thick, rough, and sometimes a little sore. If this sounds familiar, you may be dealing with a skin condition called psoriasis, a chronic autoimmune disease that affects millions of people around the world. What is psoriasis? Psoriasis is an autoimmune condition, which means the body's immune system mistakenly attacks healthy skin cells. This causes skin cells to regenerate too quickly, leading to a buildup of dead skin, forming red, inflamed patches covered with silvery white scales. These patches commonly appear on elbows, knees, scalp, lower back, and sometimes the belly button area, behind the ears, or around private parts. Psoriasis is more than just a skin condition. Many people think psoriasis is only about dry skin, but in reality, it's linked to much more. People with psoriasis have a higher risk of developing psoriatic arthritis, high blood pressure, type 2 diabetes, depression, and anxiety. These red, scaly patches don't just affect appearance, they can cause itching, pain, embarrassment, and emotional stress, especially if the condition returns often or covers large areas of the body. What can trigger psoriasis in older adults? While the exact cause of psoriasis is unknown, certain factors can trigger flare-ups or worsen symptoms, especially in people over 60, long-term stress or emotional tension, cold, dry weather, skin injuries like scratches or bug bites, certain medications, blood pressure meds, antimalarials, lithium, infections, and most importantly, a weakened immune system due to aging. Can it be treated? The good news is, psoriasis is not contagious, and it can be managed effectively. Depending on the severity, doctors may recommend topical creams to reduce inflammation and soften the skin, oral or injectable medications for more widespread symptoms. Light therapy, phototherapy, and most importantly, daily skin care and stress management. What should older adults do if they suspect psoriasis? Avoid using strong steroid creams without medical advice. Don't scratch or pick at the patches to prevent infection. Moisturize daily with gentle, fragrance-free products. Eat a balanced diet. Reduce spicy or greasy foods. Increase green vegetables. Practice relaxation, yoga, meditation, or simply deep breathing, and visit a dermatologist for proper diagnosis and personalized treatment. Closing thoughts. Psoriasis may be long-lasting, and it may return, but it is not uncontrollable. If you notice red, scaly patches, especially on your elbows, knees, or scalp, don't ignore them. The earlier you treat it, the easier it is to manage. Your skin reflects what's happening inside your body and mind, so take care of it, not just for comfort or appearance, but as part of caring for your whole self in this beautiful stage of life. Type 5, redness after taking medication, a warning sign of allergic reactions or dangerous side effects. Have you ever taken a new medication, maybe for blood pressure, joint pain, an antibiotic, or even just a common cold, and then, a few days later, red patches began to appear on your skin? At first, it might be just a few spots. Then, it spreads. Your skin may start to itch, feel hot, or even swell a little. If this has ever happened to you, it could be a sign of a drug allergy, or a side effect your body is struggling to handle. Why are older adults more prone to drug allergies? After the age of 60, the body processes medications more slowly. The liver and kidneys don't work as efficiently, so drugs can stay in the bloodstream longer, increasing the chance of side effects. Also, older adults often take multiple medications at once, for blood pressure, diabetes, heart disease, arthritis. And when several drugs interact, the risk of skin reactions or internal issues increases. How to recognize a drug-related skin reaction: redness that spreads or becomes more noticeable, itching, burning, or mild swelling. In some cases, hives, blisters, or peeling skin. Symptoms usually begin 1 to 5 days after starting a new medication. If the redness is accompanied by difficulty breathing, swelling of the lips or face, dizziness, or a fast heartbeat, this could be a severe allergic reaction, anaphylaxis, and it requires emergency care. What to do if you suspect a drug reaction? Stop taking the suspected medication, unless it's life-saving. Consult your doctor first. Notify your doctor as soon as possible to adjust or change the prescription. Do not self-medicate with strong antihistamines or steroid creams without guidance. Keep the medication box and prescription note so your doctor can identify the cause. Your doctor may recommend allergy testing or special blood tests to pinpoint which ingredient you reacted to. How to prevent drug allergies in older adults. Never take medicine based on online tips or word of mouth. When prescribed a new drug, mention any past skin reactions or allergies. Take medication exactly as directed, no skipping or doubling doses. Drink plenty of water to help the liver and kidneys process the medication. Get regular checkups to monitor liver and kidney function, especially if taking long-term medications. Closing thoughts. Redness or rashes after taking medication may seem minor, but they could be the first signs of a serious reaction. After age 60, our bodies need more care, more patience, and more attention to how they respond. Remember, treating a condition is important, but protecting your whole body while taking medication is just as essential, because every little pill, no matter how small, can become a big challenge for a body that's growing older day by day. After the age of 60, our skin is no longer just an outer layer. It becomes a mirror, quietly reflecting what's happening inside the body. Every red spot, every patch of itchiness, swelling, or flaking, could be a gentle message from within, reminding us to slow down and to care just a little more. We hope that the 5 types of skin redness we shared in today's video will help you recognize warning signs early, so you can seek care, get the right treatment, and protect your health before problems grow larger, because in later life, good health doesn't always come from big things. It comes from noticing the small changes, and listening to them every day. If you found this video helpful, please consider subscribing to our channel. We'll continue to share clear, reliable, and easy-to-understand health information, made especially for those in their golden years. Wishing you peace, good health, and the ability to truly listen to every gentle signal your body sends your way.